Did you know that in Australia, it is estimated that 45% of people will experience a mental health condition in their lifetime, and 1 in 8 will consider suicide at some point in their lives? Good morning, my name is Erik, and today's session I will be talking about people experiencing suicidal thoughts. I will outline the incidences and the economic burden of suicide in Australia, as well as provide an overview and the changes that they may face. I will give an explanation of of recovery orientated frame and the nurse's role, and finally give an overview of relevant Australian suicide support services. The Australian Institute of Health and Welfare report that in 2019, the incident rates of suicide in Australia was 12.9 deaths to every 100 people, which equates to a total of 3,318 losses of lives to suicide. However, the number of Australians who made suicidal attempts is much higher than these figures. At 65,000 per annum, despite the number of suicides decreasing, the number of people experiencing suicidal thoughts and ideation has increased dramatically. Mental Health Australia has reported economic impact suicide in 2016 was 1.6 billion dollars, and when non-fatal suicide behavior is included, Kitchen and Darwin report that in 2014 it rose to $6.7 billion. The World Health Organization has showed several determinants in increasing suicidal ideation among Australians. One factor is gender. In Australia, more females have a higher suicidal ideation than males, although 4 males will die from suicide compared to 1 female. The other factor is age. The highest proportion of deaths and suicide occurring amongst young and middle-aged people. The proportion decreases in progressively older age groups. Suicide is the leading cause of death for Australians between the age of 15 and 44. In addition, cultural factors have a role in the suicidal thoughts. For instance, the rate of suicide among Aboriginal and Torres Strait Islander people is approximately twice of non-Indigenous Australians. Relationships, community, and social networks, as well as access to healthcare, play a significant role in support and engagement and the prevention of suicide. Other factors is education, unemployment, and income security. Studies show that strong connection between the number of suicide thoughts and the length of level of unemployment experienced by a person. Another determinant is the location of where the person lives and works, as well as amenities. Overall, suicide rates in rural and remote areas show significantly higher than urban areas. Causative factors of suicide are intensive and complex. Some of the factors may include contributing to suicide include mental and physical illness, trauma, and stressful life events. Geographic and social isolation. 30 to 50 of percent of suicide self-harm incidents have some relation to alcohol and drug use. A person living with suicidal thoughts suffers from a lot of challenges, especially their social life. Suicide and people often using drugs and alcohol lead to conflict with their families and friends and withdraw from social contact, as well as often prefer being alone, and can lead to further mental health complications such as anxiety, social phobias, dependence, and personality disorder. They also tend to engage in seriously dangerous activities at times, and that might lead to loss of life and disinhibited risk activities, purchasing guns, and stockpiling hazardous pills. Suicidal people have a tendency to mood swing and personality changes. They are also known to change in their normal routines, especially regarding eating and sleeping patterns. The outcome of the above mentioned factors is a result of the consumer being consumed by suicidal thoughts and cannot function productively in their daily life. Another outcome can be education failure to impact, education failure due to impaired concentration, which can lead to poor and long-term employment prospects and earning less income that as a consequence. They may find it a challenge to develop healthy interpersonal relationships, and when they are in a relationship and more likely to engage in partner abuse, such as physical, verbal, and psychological violence and other aggressive behaviors. They also can be less interested in exercise, which can result in a more serious physical health issue, and they can experience loss of enjoyment in previously pleasurable activities, even eating. Recovery oriented practice support people in taking responsibility for their choices in their own recovery and well-being and pursuing their life goals. Nurses play a significant role in providing recovery support for a consumer who is experiencing suicidal thoughts. One of the first interventions a nurse can do to build positive and trustful relationships in consumer is showing empathy and understanding, demonstrating social sensitivity, and nurse provide a safe and environment that allows the consumer to express thoughts and feelings in a non-judgment setting. Another intervention is to undertake a holistic and comprehensive assessment risk of that includes considerations such as suicidal behavior and ideation, a history of previous attempts, assessing methods, and any plans to end their lives. The most effective method of assessment should be to focus on the details of consumers' narrative rather than their clinical checklist. The next is collaborating with their family and friends of the consumer with the intent of having them as an important information source and providing them with education and support and help their relative needs. The nurse should also work with the consumers in supporting the independence in which allowing them to access advocacy and enabling a support network to be available. Another element is to empower the consumers to make decisions about their future care, and particularly times of crisis, and form a development of a care plan. The nurse should ensure continuity and support services and transition either to home and into other services. This is a time when the consumer is a high risk of suicide. Other recovery focused strategies is to equip the consumer with self-management skills, which allows them to take responsibility for their own care and strength-based programs. This includes education on understanding risks, the ability to recognize triggers and respond to these symptoms. One of the services that offer immediate assistance to improve care and reduce impact of living with a mental illness is suicide callback service. It is a free available to all Australians over the age of 15, 24 hours a day, 7 days a week. Support can be accessed either over the phone or via online chat or video consultation. The user does not require a medical referral, which means immediate professional counseling is available at a time when the consumer can potentially be at crisis. In line with the recovery-oriented framework, this service specifically offers each session scheduled with the same counselor, which helps the rapport and trust building. Each qualified counselor can do a risk assessment and work with the consumer to goal set and ensuring safety. Importantly, the service can provide case coordinated and continued support for clients who present as having unmet needs and require ongoing support. To connect with each service in the area, the service provides a self-help link to use evidence-based resources, case studies, articles, and research. They can also have a mobile application that helps the user create a digital suicide safety plan. As you can see from this presentation, suicide is seriously socioeconomic issue with high economic burden costs. Mental health can affect people from all genders and ages and backgrounds and low socioeconomic all the way to affluent. Education of general public is rising. Awareness of mental illness is key to reducing the stigma associated with mental illness and building a culture of acceptance and inclusion.